Good morning. Welcome back to the channel. So இன்னைக்கு பார்த்தீங்கன்னா நம்ம லோ பேக் பெயினை பற்றி பார்க்க போகிறோம். We're going to see about low back pain. நான் இங்கிலீஷ்லையும் பேச போகிறேன், தமிழ்லையும் பேச போகிறேன். Because last time there were a lot of requests that why don't you speak in English also. So அதுக்காக ரெண்டு விதமான லாங்குவேஜ்லையும் நான் இன்னைக்கு பேச போகிறேன். When we speak about low back pain, there are many causes. So in a nutshell, I'm going to speak about only few causes and how can we treat it and how can we prevent it from further damage. There are many different causes for low back pain. The main thing when you lift a weight suddenly by bending forward, so that is one of the major cause. Second one, you can say when you're sitting in a position for quite a long time without standing and going, let us say you sit and work for more than 4 to 5 hours in the same place, it's going to give you some low back pain. And third most important cause is aging. Aging nala, if you see, there will be degeneration of bones and even disc, so that also will lead to low back pain. Before getting into exercises, it is always better to understand what is supporting your back. In the front it is supported by abdominal muscles, on the back it is supported by back extensor muscles, and in the lower part it is supported by gluteus muscles, which is the main three muscles which supports your lower back. And okay, we have discussed a lot about low back pain. Let's get into exercises. I'm going to show you nearly 8 exercises, and you have to do at least 8 to repetition of each exercise, and some of exercise will be of means of holding. That will be explained on the exercise itself. You can check it on. And this 8 exercise, you need to do it at least 3 times a week. And for the sets, you can do 2 sets, and in between you can have 30 seconds rest in between the sets. Okay, let's see some bridging exercises, pelvic bridging exercise. Lie on your back, bend both the knees, keep your hands aside. Now try to tilt your pelvic posteriorly, like pushing it back. See, you can push it back. Make sure your backbone is on the ground. Tuck your tummy in. Bring your hip up, and when you're bringing up, your shoulder, hip and your knee should be in same line, and then bring it down. Try to breathe out while coming up and breathe in while coming in. Bring it up and bring it in. So now let's see a bluebird exercise. Keep your arms in line with your shoulder, legs parallel to your hip, knee should be in parallel with your hip, like a camel position. You can call it as a dog also. Like now, try to lift your left arm and then alternative right leg back. Make sure your head should be straight, your shoulder, elbow, wrist should be in straight line, and your legs, hip, knee and ankle should be in straight line. Now get back to the same position, and again now move the other right arm and then left leg. Hold it for 2 seconds and get back. Hold it for 2 seconds. You have to do alternatively. So now let's do some knee to chest exercise. Lie in the same supine position, that is lying on your back. Keep your back straight. Tuck your tummy in. Make sure that your back is on the ground. Your curve here should be on the ground. Bring your right leg up towards your chest and then bring it down. The same way, bring it up, or left leg and get it down. Do it alternatively, slowly and steadily. Try to breathe out while lifting your leg up and breathe in while getting it down. So now let's see back extension with support exercise. Try to lie on your tummy with arms extended and bring back both the arms very close to your chest. Keep it near chest. Try to lift up. Hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then slowly get back. And then again come up. Hold it for 10 seconds. Breathe out and breathe in while doing the exercise. Go down. Make sure when you're lifting up, you should clear your chest level. This level has to be clear. So let's do some hip extension exercise. Keep your forehead over the arm with bent elbows. Support yourself properly. Lie on your tummy. Keep both the legs together. And then try to lift your leg up without bending the knee. And then slowly get it down. Bring it up and down. You should feel the muscles worked out, especially on your glute area, on your bum area. Okay, let's do some abs crunches. It's been a lot of myths olden days that like we should not do abs any crunches when you have back pain because that will affect our spine further. But we can do it in a modified version. Let me show you a very simple way, because abs is one of the important muscles which needs to be strengthened to make sure that we don't get a back pain again. So lying on your back, make sure again you have to push your tummy back on the ground and make sure there is no gap of curve in between. If there is big curve, you can place a pillow or a small towel roll to support the back. Tuck your tummy, keep your arms straight in parallel with your shoulder, and make sure when try to come up and lift your neck and shoulder straight and come up. See, while in the video I'm showing you like you're coming up, at the same time I'm watching the ceiling. I'm not going down or I'm not watching anyone in the forward. Watch the ceiling, neck up, shoulder up, and then slowly down. 2, 3. Breathe out while coming up so that you can ease the pressure on the abdomen. Okay, lie on your tummy. Keep your elbow bent and near your chest. Try to lift your hip up but not your legs. In normal plank, you remember we lift your knees up along with. But here in the modified version, you make sure the knees are on the ground and elbows are aligned with your shoulder, parallel with your shoulder. And then tuck your tummy in, and you can see my back and shoulder are in line with my knee. And start holding and counting. Count it for 10 counts, hold it. But don't hold your breath, but try to tuck your tummy in and give a good strong hold on your abs. 10 seconds and then relax for 10 seconds and then come back and do one more 10 seconds. Like this you have to complete at least 5 times. So we have seen all the 8 exercises. Try to do these exercises at least 8 to 12 times each exercises, and try to do 2 times with in between 30 seconds to 1 minute rest for the recovery period, and do it for 6 to 8 weeks completely, at least 3 times per week, 3 to 4 times per week continuously. It's all the exercises which I have taught you. Try to do it in a normal form is more important. Do it properly, and if you do for the 6 to 8 weeks, you'll feel a big difference from it. And if you have an intolerable pain or any radiating pain from the hip down to the leg, please consult a doctor or a physiotherapist and then start these exercises. These exercises, make sure if you don't have too much of pain, at least 50% less pain than your normal pain, then start doing these exercises. ட்ரைனிங் முடிஞ்சதும் இன்பாக்ஸில் கமெண்ட்டில் வந்து நீங்கள் மெசேஜ் போடலாம். If you want more advanced exercise after this training, I can even give you those too. So thanks for watching and be tuned for more exercises.